So after the client has had their heart attack or they've had their bypass surgery or their angioplasty, they're usually going to have for continuous exercise testing at various intervals after the event and follow-up testing after that as well. So typically, once again, they're going to use the Bruce protocol because it's aggressive, going to have good ECG monitoring, as you know, reduce the artifact. We showed the last class about the angina and the dyspnea and the claudication scale. So looking at that, obviously blood pressure monitoring, and some places may have the option of adding a metabolic cart. That's not very common, that they typically would just use the ECG, blood pressure, and the scale monitoring, but some places might have a metabolic cart that they will use, but that's not as common. What happens also if people are going to have testing, particularly if they're undergoing the diagnostic procedures for heart disease. If they think that a client has heart disease, they come in, they maybe have had the Bruce protocol, GXT, and it shows that, they maybe showed some ischemia. So the cardiologist and the physician want to do further testing. So look on Blackboard and you can see some examples of these. So they'll do an exercise echocardiogram, so an ultrasound of the heart, and it's a nice video where they show how the person will, have a resting echo, run on the treadmill, and then have an echocardiogram post-exercise. My friend who does cardiac rehab and who did that, she does a lot of this type of testing right now. Nuclear testing, again, on the links on Blackboard, they actually inject you with an isotope, again, not a radioactive, not a strong radioactive, and so they can look at your the blood flow of your arteries, look at your ventricular ejection, how much blood is being let go. And so that is something that they will also do too, maybe prior to a person having a cardiac catheterization. They can also do non-exercise testing. They can inject people with drugs. The drug they use is called dobutamine, so it's kind of like an epinephrine similar type of drug. So when you can't get a person, say you have somebody who's really senior, really up there in age, and they're very deconditioned, or maybe they've got orthopedic limitations, so when they can't exercise. So that might be done. And of course the angiography, once again, look at the link site on the American Heart to show what the angiography looks like. That is really the gold standard. That's going to rule out whether someone has heart disease or not, whether they've got that greater than 70% blockage in their arteries. Cardiac rehab phases. We've talked a little bit about this. In the old days, people who had a heart attack or really any type of major surgery, you were told to stay in bed and you had to be on bed rest. That is no longer the case. They will get you moving up and around as soon as possible. So oftentimes the same day. So phase 1 is that inpatient exercise program, even if it's just walking around a little bit in your room or just venturing down the hall. So they will start increasing your activity right away within the hospital in the inpatient program. Phase 2 is what most people are probably familiar with. So this is where the client is discharged from the hospital. They come into the hospital still, or maybe the cardiologist's office, on an outpatient basis, and they are closely supervised. They usually have what's called the telemetry. So they're walking around. It's similar to a polar monitor, but you can see their ECG. They're going to have their blood pressure monitored. They're going to have their oxygen saturation monitored. So that's what we usually think of when we think of cardiac rehab, something that's going to take place in hospital or a doctor's setting. And then phase 3 is once they're released from that. So less supervision. So these are the people who are going to be coming to you. So maybe they did the outpatient cardiac rehab phase 2 at the hospital, but now they're back and they're back to work as a faculty staff member, and they want to come back to the West Center, they want to come back to the Y or the corporate wellness center where you work. So you have to understand, how to work with these people who are in these phase 3, this maintenance program. The physician will look at their MET levels, their GXT results, heart rate, the maximum heart rate. They're probably going to be doing some resistance training along with their aerobic exercise as well. So they will come out with an exercise prescription, from their cardiac rehab program.